Hello, everyone. My name is Shawn Ames, and today I will be presenting my capstone project titled Predictive Analytics for Healthcare Claim Denial Risk Scoring, a Proof of Concept Framework for Revenue Cycle Decision Support. Healthcare organizations operate in one of the most complex reimbursement environments in the industry. Every day, thousands of insurance claims are submitted to payers, and while many are processed successfully, others are denied because of documentation issues, coding errors, missing prior authorizations, eligibility problems, or payer-specific billing requirements. Every claim denied represents much more than a delayed reimbursement. It creates administrative rework, increases operating costs, slows cash flow, contributes to revenue leakage, and delays the organization's ability to recognize and collect earned revenue. These challenges affect not only finance departments, but also revenue cycle teams, clinical staff, and the patients who depend on timely and accurate billing. As a healthcare net revenue analyst, I have seen firsthand how denial trends influence reimbursement performance, financial reporting, and an organization's ability to accurately estimate net patient revenue. In my role, it is important to understand not only what has happened financially, but also why it happened and what operational factors are driving those results. That perspective inspired this project. Insurance claim denials are one of the most significant financial challenges facing healthcare organizations today. Every claim denied represents revenue that has been earned but cannot be collected until the issue is resolved. The impact extends beyond the finance department. Providers, coders, patient access teams, and revenue cycle professionals all become involved in resolving denied claims. Patients may also experience billing delays or unexpected financial responsibility, which can negatively affect their overall experience with the healthcare organization. Most healthcare organizations rely on traditional rules-based claims editing systems, often called claim scrubbers. These tools are effective at identifying known billing errors based on predefined rules. However, they have an important limitation. They generally identify problems only after the claim has already been prepared for submission, and they may not recognize more complex patterns hidden within the historical claims data. That limitation led me to ask an important question. What if we could use predictive analytics to identify claims that are most likely to be denied before they are ever submitted? If organizations could proactively identify those high-risk claims, they could intervene earlier, reduce preventable denials, improve reimbursement performance, and strengthen overall financial performance. This business challenge became the foundation for my proof of concept project. After identifying the business problem, the next step was developing a practical solution. The objective of my capstone project was to create a proof of concept demonstrating how predictive analytics can complement existing denial management processes by identifying claims that are likely to be denied before they're submitted. Rather than waiting for denials to occur and reacting afterward, the goal was to help revenue cycle teams become more proactive by identifying high-risk claims earlier in the reimbursement process. To accomplish this, I developed an integrated analytics workflow that combined three technologies, each serving a specific purpose. First, Microsoft Excel was used to verify data accuracy and calculate key performance indicators. Next, I used Python to develop a predictive model that evaluated historical claim characteristics and assigned each claim a denial risk score. Based on that score, claims were categorized as high, medium, or low risk, allowing users to quickly identify which claims required additional attention before submission. Finally, I used Tableau to transform the analytical results into an executive dashboard. Instead of reviewing multiple spreadsheets or static reports, leadership can monitor key performance indicators, identify denial trends, evaluate financial exposure, and prioritize high-risk claims that support faster and more informed decision-making. One of the most important aspects of this project is that it is not designed to replace healthcare finance or revenue cycle professionals. Instead, predictive analytics serves as a decision support tool. It provides earlier insights that allow experienced professionals to focus their expertise where it can have the greatest impact, helping organizations reduce preventable denials, improve reimbursement performance, and strengthen overall revenue cycle operations. This integrated approach demonstrates how accounting, healthcare finance, and technologies can work together to improve both operational efficiency and financial performance. To demonstrate the feasibility of the solution, I developed a proof of concept using synthetic healthcare claims data. Using synthetic data allowed me to simulate a realistic health claims environment while maintaining HIPAA compliance, protecting patient privacy. The goal of this project was not to build a production-ready application, but to demonstrate how predictive analytics can be integrated into the revenue cycle to support better business decisions. Ultimately, this proof of concept demonstrates that predictive analytics can convert raw healthcare claims data into actionable business intelligence. As mentioned before, each claim receives a denial risk score, which is then translated into a high, medium, or low risk category. The model also generates a risk explanation column that identifies the specific factors contributing to the score, making the results transparent and easy for revenue cycle professionals to interpret. The scoring model considers several common denial drivers, including authorization issues, documentation deficiencies, coding errors, eligibility and coverage problems, medical necessity, administrative issues, timely filing, and high dollar claims. Claims with more significant risk factors receive higher scores and are prioritized for review before submission. After the claims were scored, Python and Excel were used to calculate key performance indicators such as total claims, appeal rates, appeal success rates, recovery amounts, high-risk claims, average days to resolution, and projected financial metrics, including net financial benefit and return on investment. Finally, the scored data was imported into Tableau, where it was transformed into an executive dashboard. This Tableau dashboard brings together several key performance indicators that provide executives with a comprehensive view of revenue cycle performance. First, total claims process, which is 194, measures overall volume of claims submitted during the reporting period. This provides context for understanding workload reimbursement activity and overall operational performance. Next, the total amount recovered, $56,111, represents the revenue successfully collected after denied claims were corrected and reimbursed. This metric demonstrates the effectiveness of denial management efforts and highlights revenue that would otherwise have been lost. Another important KPI is the appeal success rate, which is 33%, and it measures the percentage of denied claims that are successfully overturned through the appeals process. Higher success rate reflects effective denial resolution while also identifying opportunities to prevent similar denials in the future. The dashboard also identifies high-risk claims, or claims that the predictive model estimates have a high likelihood of being denied before submission. In this case, it's 19. This allows revenue cycle teams to proactively review these claims, reducing costly rework and improving clean claim rates. Closely related is the high-risk claim amount, which measures the total dollar value associated with those high-risk claims. This helps leadership prioritize claims with the greatest potential financial impact and protect organizational cash flow. The average days to resolution tracks how long it takes to resolve denied claims. Reducing this time improves operational efficiency, accelerates reimbursement, and strengthens cash flow. Finally, the dashboard includes two financial performance measures: projected net financial benefit, which estimates the financial value created after implementation costs are considered, and projected return on investment evaluates whether the expected financial benefits justify investing in predictive analytics. While each KPI provides valuable information individually, Together, they tell a complete story about the organization's financial performance and denial risk. This enables leaders to shift from reacting to denials after they occur to proactively managing reimbursement before claims are submitted. The proof of concept produced several important findings. First, predictive analytics can identify patterns associated with claim denials before claims are submitted, allowing organizations to intervene earlier in the revenue cycle. Second, combining Python, Excel, and Tableau creates an integrated analytical workflow that transforms large volumes of healthcare claims data into meaningful executive insights. Third, executive dashboards provide leaders with a concise view of organizational performance by highlighting high-risk claims, recovery opportunities, appeal performance, and financial exposure in a format that is easy to understand. And finally, the project demonstrates that predictive analytics is most effective when it enhances professional judgment rather than replacing experienced healthcare finance and revenue cycle professionals. While this project demonstrates the technical application of predictive analytics, its greatest value lies in the business outcomes it can help healthcare organizations achieve. By identifying denial risk before claims are submitted, organizations can utilize a proactive revenue cycle strategy focused on prevention and early intervention. From a financial perspective, this approach can improve the accuracy of net patient revenue forecasting by reducing uncertainty around claim reimbursement. Earlier identification of high-risk claims also has the potential to shorten reimbursement cycles, improve cash flow, and increase overall net revenue collection. Operationally, predictive analytics can reduce the time staff spend investigating, correcting, and resubmitting denied claims. This lowers administrative rework costs and allows revenue cycle professionals to focus on higher value activities such as improving billing quality, analyzing denial trends, and strengthening payer relationships. While this project demonstrates that predictive analytics can support healthcare denial management, it is important to remember that this is a proof of concept. There are several opportunities to expand this solution and increase its value to healthcare organizations. One opportunity would be to integrate the predictive model directly into an electronic health record or a claims management system. This would allow denial risk to be automatically evaluated during the claims process, giving revenue cycle teams immediate feedback before claims are submitted. Another opportunity is to enhance the predictive model by advanced machine learning algorithms. As more historical claims data becomes available, the model could continuously learn from previous outcomes, improving its accuracy and adapting to changing payer requirements. Future versions could also include automated alerts that notify billing specialists when a claim has been identified as high risk. This will also allow staff to resolve potential issues proactively, reducing preventable denials and improving clean claim rates. From a financial perspective, the dashboard could be expanded to include additional metrics such as denial recovery rates, payer-specific denial trends, and reimbursement forecasting. These enhancements would provide executives with even greater insight into financial performance and revenue cycle operations. And last, the executive dashboard could be enhanced with real-time data refreshes and drill-down capabilities, allowing leaders to move from high-level performance indicators to detailed claim-level information with just a few clicks. Together, these enhancements would transform this project from a proof of concept into a scalable, production-ready decision support solution that helps healthcare organizations improve operational efficiency, strengthen financial performance, and make more informed data-driven decisions. As I conclude, I'd like to return to the central question that inspired this project. What if healthcare organizations could identify denial risk before claims were ever submitted? This capstone demonstrates that predictive analytics can help answer that question by providing earlier visibility into denial risk and supporting more proactive revenue cycle management. By combining data analytics with accounting and healthcare finance principles, Organizations can move beyond simply reporting financial outcomes to anticipating and managing financial risk before it impacts reimbursement. For me, this project represents more than learning new technologies. It demonstrates how finance professionals can use analytics to solve real business challenges, improve decision making, and create measurable value for healthcare organizations. While this project was developed as a proof of concept, it highlights the tremendous opportunity for predictive analytics to strengthen financial reporting, improve reimbursement performance, and support more informed strategic decisions. As healthcare continues its digital transformation, professionals who combine accounting expertise with data analytics will be well positioned to lead that change. I leave you with one final thought. The future of healthcare finance isn't about replacing professional judgment with technology. It's about using technology to make professional judgment even stronger. Thank you for your time and attention. I sincerely appreciate the opportunity to share my capstone project with you today. Be well, everyone.